Hey, what's up guys? So today we're going to talk about how Ansu Fati and FC Barcelona medical team finally came to a decision to completely remove part of his left meniscus that's been causing him issues and pain for months now. But if we haven't met yet, my name is Jin. I'm a second year DPT student. Be sure to check out my channel if you are interested in physical therapy and DPT school related contents. Also, if you are a Barcelona fan, let me know in the comments down below so I know who you are. Alright, so many of you guys have been asking for injury update video on Ansu Fati ever since he went down with his left knee injury in a Liga game against Real Betis back in November of 2020. And I can tell you that removing the part of his meniscus completely, removing part of the meniscus that they have been trying to stitch back together for a month now, was definitely the last resort, and we'll talk about what implications that may have on his career. But first, let's do a quick recap since it has been a while. So back in November 2020, Fati tore his left medial meniscus, which is a cartilage that pretty much sits between your tibia and your femur, and it works as a shock absorber. It was that sudden twist in his left knee while his left foot was planted that tore his left medial meniscus. And initially, the Barcelona medical team decided that it was best for Fati to undergo an arthroscopic surgery to repair and stitch up that part of the meniscus that's been damaged, and gave a 4-month return to play timeline. So meniscal repair was the first operation done on Fati's knee, and that's basically stitching up part of his meniscus that's been torn. And the medical team decided that it was best for Fati to undergo meniscal repair as opposed to meniscectomy, which is completely removing part of the meniscus that's been torn, because Fati is still a very young player with a very promising future. Now, it's important to note that the return to play timeline for meniscal repair is longer. It's 4 to 5 months compared to meniscectomy. The return to play timeline for that is 7 to 9 weeks, so it's significantly shorter. But I agree with the medical team here that Fati is a player worth investing in, although it may take him a little longer to come back to training. But really none of that matters at this point because it didn't go as planned. So the reason why we want to stay away from completely removing part of the meniscus that's been torn is because your meniscus is worth keeping, even if that means it's stitched up. For a footballer, having smooth motion at the knee is extremely important, and the meniscus also plays a significant role in absorbing shock between your tibia and your femur, and so it prevents bone-on-bone rubbing. So in terms of long-term outcomes, yes, that's very important. So that was the first attempt at trying to fix Fati's meniscus. Multiple sources say different things at this point about why the operation failed. Some say that Fati, when he went to training after the rehab process, he wasn't able to continue with training because of the pain he experienced at the surgical site. There are other sources that are saying there was an infection at the surgical site. I looked up different things, not really sure which one to trust. None of these are from Barcelona's official sites or Twitter or anything like that. So I guess at this point, for some unknown reason, we know that Fati had to undergo second knee surgery. And all that brings us to the present time, where Fati is getting ready to get another knee surgery in. And that's because they said, okay, we have tried to save his meniscus by repairing it. It has not worked. So this time, let's remove part of his meniscus that's been torn and see what happens. Like I said, the new timeline for meniscectomy, where they completely remove part of the meniscus that's been torn, is 7 to 9 weeks. So 7 to 9 weeks from here, that'll put us in off season, and hopefully Fati will be able to get proper rehab and good conditioning and work his way up to starting next season, because I really miss seeing him play. Alright, so now that we discussed all that, let's talk about rehab timeline for Fati and what his next 7 to 9 weeks would look like. Alright, so stage 1, 0 to 2 weeks. Right after the surgery, it will be extremely important to ensure medical stability and address the basics. Although the surgery isn't the most dangerous surgery in the grand scheme of things, you're still opening up that knee, and your knee's going through a lot. So you want to make sure you do everything you can to address the basics, like controlling the swelling, making sure there's no infection at the site, and basically setting the patient up for success with early mobility and regaining that range of motion. Alright, so stage 2, around 2 to 3 weeks after the surgery, Fati should be able to walk without crutches, and he should also be able to bear weight on his left foot, but you're still being a little cautious, so it's important to avoid extreme range of motions at the knee, and still no jumping or running. So by stage 3, this would be around 4 weeks after the surgery, we can start introducing light jogging, plyometrics, anything that's sports specific really. And Fati playing forward or in the wing, it would be important to address proper sprint mechanics so we can decrease the likelihood of re-injury, and also anything from ball control to cutting or agility skills. There's a lot of things that you can do to be creative here. Alright, so that is the update on Fati's injury. I hope you guys enjoyed the video. I definitely enjoyed making this video. If you have any questions or comments, please leave them down below, and I would love to interact with you guys. And I'll see you guys next week. Bye.